Let's talk about the idea of interventions in pregnancy and birth. In pregnancy and birth, there are some very obvious interventions. Anytime there's a medical procedure done, or, say you're in labor and they want to hurry things along and they say, we can just break your waters and then things will go right along. Or say you're 41 weeks and your doctor starts to talk about induction. That's an intervention. The lesser known interventions are every single intervention leading up to that point. That being words. There is such a strong power in words that people often overlook it. It is insidious, and so people often overlook it. What do I mean? People have famously said that words are like casting spells. When you speak out over something, you are kind of giving that thing a destiny or giving it a direction or controlling the destiny of that thing. Words have a lot of power. Words can go into your mind and transform your thoughts, even subconsciously, without your permission and even without your knowledge. Words have a lot of power to transform what materializes in your body. From the moment that you realize you're pregnant, if you are going to a regular doctor's office, what you might not know or what you might not notice is that most doctors are coming at a pregnancy from a place of pathology. Many doctors are looking at pregnancy in terms of, we have this list of things that can go wrong and we need to prevent all of them. So by taking that approach to pregnancy, they are then focusing on all of the things that could go wrong and therefore putting energy on those things, talking about those things, looking for those things, and sometimes almost creating the problems themselves. Also, excessive discussion of potential problems tends to put stress on the mother and therefore on the baby. These things are not good for pregnancy, and these are the first interventions. This is something that took me years to understand. The words that people are saying to you when you're conceiving, when you're pregnant, when you're giving birth, and even afterward, those things are interventions. If you say you want a low intervention pregnancy because you realize the value of having one, leading to a healthier pregnancy, then that means that you need to stay away from the negative energy and the negative words and attention going towards you. I'm not saying that you shouldn't do any medical checks. I'm not saying you shouldn't have any conversations with doctors, but it needs to be a clear dynamic between you and your medical provider when you are going in for appointments, when you're having conversations, that you want to take a certain approach with them and that you see pregnancy as the natural event that it is. And you are coming to your pregnancy with the idea that it is natural and healthy, and you will just do everything you can to nurture your body and your baby. There is no reason to expect things to go wrong. Yes, you can be connected to a doctor, or you are getting some of these blood tests if you would like to do that, or ultrasound checks, but you don't need to sit at every appointment and discuss all the things that are going to go wrong. I've seen this focus on pathology lead to negative things for women, from stress to just snowballing into much bigger things that they need to do, ending up in decisions to induce early or to have a cesarean when it was truly unnecessary and led to even further complications for the mother and the baby. This is so not necessary. Have a healthy focus on your pregnancy. Recognize your pregnancy to be the natural process that it is, and you don't need interventions. Follow me for more healthy and productive pregnancy tips.